everyone. Thank you for having me. Um, as as um, as mentioned by Mr. Miller, Dr. Miller, I am with the Sisters Network Group affiliated, and as a cancer survivor, I felt it was my duty to be helpful in that and participate with that organization. I am 7 years cancer free. I was diagnosed in February 2014, and I opted to have a double mastectomy. The journey's been interesting. I can say that with the support of friends and family, and even those that I've never met before who are also survivors themselves, it helped. It helped tremendously. And seeing, the progress of the research that's put into hopefully one day coming up with a cure. um, I'm thankful for what I was able to receive, and hopefully going forward that other survivors will be able to benefit from. If not, who knows, maybe there's a cure in the years to come. I pray so. um, I have thoroughly enjoyed everyone's speaking presentations. Thank you for what you're doing, what you're going to do. You're leading the path for maybe someone who's interested in doing what you're doing, and maybe can pick up the mantle uh, when the time comes for them to step in. Um, and I thank you for having me here again in representing Sisters Network, and then also representing survivors like myself.
Thank you so much, Ms. Young. It's an honor to have you. Thank you for all the inspirational words you have.
Thank you again, Dr. Rainey, for such a wonderful talk. Now I will welcome back Dr. Oscar Miller as he introduces another special speaker. Welcome back, Dr. Miller.
Thank you, Dr. Reed. Earlier, I mentioned several members of the Community Advisory Board, or the number of members of the Community Advisory Board, and I see that several are attending today. So I just wanted to acknowledge them and thank them for attending. And I also wanted to name the two co-chairs of the Community Advisory Board, Ms. Ela McDermott and Ms. Sheila Doris Winfield. Our next speaker is Mr. Richard Bowers. He's a retired professor from Fisk University who is currently undergoing cancer treatment during the pandemic. So please join me in welcoming Mr. Bowers.
Good morning. As he said, I'm Richard Bowers, and I'm a retired educator, previously in Metro Public School System, and of course, 19 years as Director of Teacher Education at the historic Fisk University. Of course, changes were made at Fisk, and so my program was cut. And so I'm here to speak with you about my experience in treatment as a cancer patient, specifically colon cancer, and some of the limitations it may have caused me maneuvering through COVID-19. 2019 was not a good year for me, losing a job, and then 2 weeks prior to Christmas, my father passed, and then 2 weeks after that, getting this diagnosis. I immediately thought when I got this diagnosis, well, prior to having this diagnosis, I had been on a medication, hydroxychloroquine, and my rheumatologist had given me that specifically because I was having some problems with my knee. And so I initially had some complications after taking this medication several months, and I thought, okay, the medication may be causing this problem. So I immediately was scheduled for a colonoscopy. And so I went in for that colonoscopy. And after that, the doctor came and he said, I have bad news for you. And he said, I'm sorry to tell you that I think you have cancer. And he said, what I would like to do is refer you to a hematologist. And so I found myself, well, the next day he called me and he said, Mr. Bowers, I don't want you to worry. I don't want you to worry about this, but I'm quite sure it's cancer. But my brain is somewhat numb and I'm thinking, how can you not worry about this? And so that Friday, that was a Wednesday, Thursday, Friday, I found myself in the oncology office at the hospital. And so the doctor immediately said, I would like to refer you to a surgeon because we'd like to do another colonoscopy, do a biopsy, get a bigger sample. And so we would like to do that. And so that procedure was done. The next thing I knew, I was doing radiation. And so by that time, we were totally into COVID-19 and everything was somewhat locked down. And so what went through my mind is, how am I going to maneuver through this and not get the virus, catch anything of that nature? And so on a daily basis, I was doing radiation treatment for 30 days. And so during that time, every day I would listen to Dr. Hildreth and all the other professionals through the news media talking about COVID-19 and what you should do and should not do, the CDC guidelines and so forth. And I would actually, every day I'd go to the hospital, I actually would try to find which elevator would not have the most people on it, okay? And so I would get on that particular elevator, do my treatment, make sure I had on 2 masks, gloves and all, okay? And so I went through the radiation treatment and I was actually taking chemo pills. So treatment went well. And then around September, I started having some issues as far as breathing. And so what had happened, I had some fluids that had metastasized in my lungs. And so ended up getting fluid in my lungs, right lung. And so went into the hospital overnight. They drained that fluid, had a drainage tube for about a couple of months. And then everything was fine. And then a month later, ended up getting fluid in the other lung. And so that was drained. Currently right now, and so after that procedure, they decided, okay, we needed to do an IV, chemotherapy through IV. And so that's why I am currently going through chemotherapy. I do that every 3 weeks. And forgive me because I'm a little lethargic because I had a treatment and it also causes my, with the medications I take, it causes my mouth to be somewhat dry, and I say cotton mouth, okay? So I have a good oncology team of individuals, okay? I did not have surgery, although my surgeon monitors me, and everything seems as though it's going in the right direction. I can say that as far as the care team, I have a good team of individuals. What helped me get through all this was with COVID-19 and everything being locked down, had a group of friends, and we've been friends since undergrad, graduate school, so forth. And so we would talk 1, 2, 3, 4 o'clock in the morning because there was nothing else to do. And so that actually kept us going because to know it or not, they had been in the same situation that I had been in, and they had not discussed it with anyone. One individual had breast cancer, and another male had prostate cancer. And so we were all one big group of individuals. I did not let this depress me because with me losing my father, and me being the child of a minister, my dad was a United Methodist minister, I sort of relied on my faith and what my dad had taught me. And excuse me. I know with this particular situation, I'm going to overcome this, okay? I've been in treatment a year now. And I can say, with my hematologist, I told him, I said, first and foremost, I put everything in his hands up above. And then secondly, I'm going to trust your judgment because you're the doctor. And you know more about this than I do. And so that's where I'm at in this process. I can say that I just try to stay on track, follow the CDC guidelines, doing what I'm supposed to do as far as wearing the mask, washing your hands, the whole 9 yards. I can say in the beginning when I thought, okay, I'm going to do this treatment. I'm not going to come out of this house. And so I was one of those individuals who stockpiled food, toilet paper, the whole 9 yards, because I said, no, we're not coming out of this house. I don't want to catch anything. I don't want to get pneumonia. I don't want anything. I'm a family. I have a very small family, an older sister and brother. And we all kept our distance. And even though we all have our own homes, we check, we talk to each other on a daily basis, and at least twice a day. And we make sure that each other are okay, because that's what my father would want us to do. And so being a native Nashvilleian, I'm a TSU grad, MTSU grad. I wanted to be a part of this because I think this is something that is very important. And I said to myself that if I come through this, something I want to do, and I don't know how it will come about, is to spend the rest of my life working with cancer patients, okay? And so it is a pleasure to, and I know time is of the essence. It is a pleasure to be with you all this morning. And I think that you are doing such good work. And the only thing I can say, we are so blessed to have individuals such as yourself who are really working hard to beat this particular disease.
Absolutely. Thank you so much, Mr. Bowers. I'll tell you, you have 80 other people here rooting for you and are rooting you on. And thank you so much for coming on. And we're going to be excited with you leading those patient advocacy roles, seeming like what you're, hoping to take on in your next role. So we're all here for you and we're rooting for you. Okay.
Thank you.
Thank you again.